Good morning, everyone. So, today I want to discuss with you a really interesting thing, which is, do you allow partners or escorts in the room when you are performing oral surgery? And the answer is yes or no. Please share with me your answers. So, I want to share with you what I do in my practice, but first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own dental practice, Lakeside Dental Spa in Hervey Bay in Queensland, and you can check the details below. And I took my practice from one chair to 10 chairs. We started with a team members of 3 staff members, and now we are close to 40 staff members. So I'll give you 3 stories first, and then I will tell you what I do nowadays. And again, those stories are early on in my career when I wasn't as experienced as now. Story number 1 is I was performing an extraction. Deciduous tooth extraction, simple extraction on a child. Child was probably around 8 or 9 year old, and the dad was in the room, and the dad was observing the extraction. And after I numbed the child up and I start using the forceps, the dad just left the room, didn't say anything. He just left the room. And back then I had a small practice, so the bathroom was next to my room. And we heard this loud noise in the bathroom. So we all ran. The door was locked. We knocked on the door. He didn't answer. So we unlocked the door. And the guy just simply fainted. So what I understood, and he split, his head was open. He was bleeding. We called the ambulance. What we understood, when the patient was observing the extraction of his child, he saw blood. He started getting sick. He didn't tell us he was getting sick. He went to the bathroom and he fainted and he hit his head on the sink and he split his head open. Of course, the whole thing was messy because the child was crying when they saw their dad, because the child came out to have a look as well. The ambulance came. Everything was very, very messy. Patient didn't complain or anything. It just was a very messy situation. The second story that I have for you is I was doing a filling. That wasn't even an extraction. No, actually, it was a filling and an extraction. And as part of the process I was doing, when I was doing the filling part before the extraction, I was putting the matrix band on a child, and sometimes you put the matrix band, you get a bit of bleeding from the gums, and a bit of blood went on the tongue, and you can see a bit of like drops of blood on the tongue as well. And the parent was watching, and the mom out loud like, "Oh, you cut her tongue." And of course, the kid heard that, start panicking because they're numb, they don't feel anything. They start panicking, they start crying. The mom is panicking, and it's like, just to reassure the mom and show her, look, there is no cut. There's nothing wrong. It took a while, and still, it was very hard to manage. I mean, the whole kid was already crying. We couldn't do anything on that day. We had to let them go. It was a very hard situation to manage. Another story I had as well before is when I had a patient. I was extracting an upper second molar. Very rare complication. I was very inexperienced back then as well. I was only like 2 years into practice ownership and 4 years out of dentistry. And I was doing an extraction on a patient, and his wife was 9 months pregnant, and first child, first baby. And they actually told me that their first baby was a stillbirth, and they're really excited about this pregnancy. And I was doing the extraction. It was a difficult extraction. I was very inexperienced back then as well. It's a very small complication that can happen, very rarely happens now, where the buccal plates start to break a little bit during the extraction. And the patient was watching, and she saw the buccal plate moving a little bit. She started getting sick when she saw that, and she started getting contractions, and she's like, "I'm going into labor." And we had to stop the extraction, so we had to call an ambulance for the patient. And again, the whole process went very messy after that. So my advice to you, and I'm very strict on this now, or since then, if you're doing oral surgery, especially extractions, make sure you inform the patient and the escort, the partner or whoever in the room, look, you can be there when I'm giving the anesthetic. I'm okay with that. But once I start to do the extraction or surgery, I will need you out of the room. Or ideally, you'd rather be out when I'm doing the anesthetic. It's like, "Oh, why we want to be there? We want to watch. I want you to be there." Look, I cannot do it. It's very unsafe. I need to focus all my attention on you as a patient. If something happened to whatever is happening around me, I don't want to be distracted by that. And this happened in the past. I will never do that. And if you think about it, very rarely a surgeon in the hospital will allow any escort in the room, especially in theater. Sometimes in pregnancy, of course, they allow them at the other end. Sometimes they don't allow them on the end where they're delivering or doing the C-section. There is like a small, sometimes small partition or small curtain or something to block the view. Or sometimes they allow them, but make sure you don't look too much. So anyway, I will tell them, no, I'm not comfortable doing that. It's not going to work. And again, very rarely I've had patients be resisting that. Most of them, oh, damn, okay, I'll let them out. Children is a bit different. I don't treat much children now except for frenectomies and certain procedures. But again, if I get the parent to trust me enough, I say, look, I can't have you in the room. First, it's going to be hard to manage the child when you're in the room. And if the child is trusting me enough and you trust me enough, I'd rather give them better care than if the child insists on their parents in the room. Sometimes you can negotiate with them. Okay, I will let your parent be in the room when I'm giving the anesthetic and everything. But once I start the extraction, I want them out. When I used to do that, when I used to treat a lot of children, it was working really fine as well. Very rarely I will have a child resisting after establishing this trust. And if you establish enough trust with a child, the treatment will become a lot easier. If they really insist on having their parent in the room, sometimes you cannot manage this child. They start crying, parent gets emotional, the child gets emotional, and it's going to be very hard to manage the child. So even with children, I used to do that. I don't treat as much children now, but when I do, I still try to get the parent out of the room as much as I can. I had one patient who was, I was doing an extraction and his partner was a medical nurse, and she said, I'm a nurse, don't worry, I've seen a lot of surgeries, I want to be watching that. And I still insist, no, I'm not going to do it. If you're a nurse and you work in a hospital, you understand very clearly that the surgeon will have to make the call. And for me, again, I want to focus all my attention on the patient. And again, probably she's a nurse, she's not going to faint, but for me, there is a lot of other things that can trigger a lot of different responses. She could be communicating during the treatment, we're going to use this, you're going to cut it this way. What about her partner? Maybe the partner is not comfortable or the patient is not comfortable with hearing those terms. And they might hear some medical terms and start getting really anxious. So even if the patient escort is in the medical field, I'll try to get them out of the room. Exceptions are if they are a dentist and they want to observe, they want to learn, and I'm comfortable teaching, I will let them be there. But if they are a dentist, let's say you are maybe 2 or 3 years out of dentistry, you're not comfortable teaching, you're not comfortable other dentists watching you working, and the partners or the patient's partner is a dentist, let's say not qualified yet, or a 5-year student or a 5th-year student, or from a different country, I say, I want to watch and learn. This might put a lot of anxiety in you. You might be very stressed performing. And you have to be very honest and open to them. Look, I'm not comfortable you watching me doing dentistry. It's going to put more stress on me. I'd rather you be outside the room. Then if they say, but I want to see what you're doing. Now they don't want to learn. They want to test you. And again, if this puts a lot of pressure on you, draw the line. Look, I'm not comfortable with you if you watching me. If you have any doubts or you don't trust me performing dentistry on your partner, then maybe I'm not the right dentist for you. I will refer to someone who's more experienced that will allow you to watch and be comfortable you watching. Be very honest. Don't put extra pressure on yourself. If you feel like someone is testing you and going to find any faults in your dentistry and you are not that experienced to manage that, don't do it. Just simply, I'm not comfortable doing that. I'll refer to someone else. So draw the line of what's comfortable for you. I hope you find this information helpful for you. If you like it, please make sure you like and share it with your friends and colleagues. If you want to hear more about my videos and my stories, subscribe to my channel and turn the notification on, and you'll be notified when more videos are released. Thank you so much for listening. It means a lot to me.